For example, in primary care, we have really good evidence that continuity, that having a trusted healing relationship with a primary care clinician has good outcomes over time. And yet we destroy that when we try and maximize access, try to make sure that any patient who wants to get care gets that care as soon as they can. And while you would think that's important too, what that really is about is keeping my schedule full so that we can maximize our dollars per hour. And that gets right in the way of making sure that someone gets to see me when they need to see me because we've been together for a long time. And that's not always valued by young people who don't have a lot of health issues. But as we get older, or if we have chronic health conditions, having the same person often means that things will turn out better.
So
And
you like saying that sometimes there's tension between different ways of measuring quality, access versus continuity?
there absolutely is a tension there, and both are important. Someone should be able to be seen soon, and someone should be able to see someone that they need to see. And those are in tension because one of them has an economic engine attached to it. And that
Hmm.
practice or the health system's incentive is to make sure my schedule stays full.
Okay.
But it's not just attention. If that fundamental measure that's so important in primary care is not made high value, it means that I'm just getting churn. I'm just seeing different people all the time and I have no relationships with them. It's harder for me to learn what they've been through, what their priorities are, what their values are, what they're scared of. And it's hard for me to change their behavior because it's hard for me to relate to them on a personal level when it's just a transaction. So that's one example of a really high value measure that doesn't get measured because it is intention and because we have 100 other measures that we're trying to work to every day.